Thank you, Caitlin. Good morning. Let me start by saying I've never worn readers until this very moment. So we're going to see how this goes. So each year for Illinois' Kids Count report, we use the best available data to measure the educational, social and emotional, economic and physical well-being of children in Illinois. Through our Kids Count work throughout the year, we provide policymakers, advocates, and the broader public with benchmarks of child well-being. This year's report, Moving Policy, Making Progress, examines the significant strides to improve the lives of children and their families in Illinois over the past 25 years. The report focuses on achievements and challenges in early childhood education, healthcare coverage, access to child care services, and other featured policy areas. Many of you here this morning were involved in the work over the past 25 years. I know we are all here today to learn what more we can do and what we can do better for Illinois children and their families. Let's start by reviewing the progress in these key areas. Illinois has been a nationwide leader in expanding access to early learning opportunities. Between 1998 and 2009, participation in state-funded preschool programs doubled with more than 95,000 children. In 2011, Illinois ranked first among the states in participation of 3-year-olds in state-funded preschool and 15th in participation among 4-year-olds. This is important. Extensive research and our own experience show that children who attend preschool repeat grades less. They have fewer behavioral problems in school, they graduate at higher rates than their peers who didn't attend preschool, and kids who attend preschool earn more as adults. Over the past several decades, there's been a quiet revolution in healthcare coverage for Illinois children. As a result of coverage through Medicaid, the Children's Health Insurance Program, or CHIP, and All Kids expansion, Illinois has one of the lowest rates of uninsured children in the nation. More than 1.7 children are now enrolled in Medicaid, CHIP, and All Kids expansion. In 2011, less than 4% of Illinois children were uninsured, giving us the lowest uninsured rate in the Midwest and the 5th lowest in the nation. That's good for kids and good for the economy. Healthy children miss fewer days of school, and their parents miss fewer days of work. Affordable, stable, and high-quality child care allows low-income parents to work and ensures children are in a safe environment that encourages their healthy development. Illinois was one of a handful of states that instituted broad access to child care assistance with eligibility based on a family's income level and not its current or previous welfare status. The Child Care Assistance Program now serves about 170,000 children each month. Approximately 60% of the kids served are under the age of 8. Almost half are from families living below poverty level. Beginning in the late 1990s, the state's child welfare system greatly improved its efforts to protect children from abuse and neglect and provide them with stable, permanent living arrangements. Illinois received national recognition for innovations that greatly reduced the number of children in substitute care, increased adoptions and subsidized guardianships, and encouraged family reunification. Today, Illinois has one of the lowest foster care entry rates in the country, and our permanency rates remain high. Home visiting programs provide intensive services and supports for at-risk families with young children or those expecting children. Research has shown that home visiting can contribute to improved birth outcomes, enhanced child cognitive development and academic success, and stronger child-parent interactions. Funding for the 2 programs you see here, Healthy Families Illinois and Parents Too Soon, peaked at $22.4 million in FY 2009, was cut by 10% the next year, and has increased slightly since then. Most recently, the state has benefited from new federal support to increase the availability of evidence-based home visiting programs. And finally, the Earned Income Tax Credit, or EITC. Research shows that the federal EITC encourages work, helps families meet basic needs, and improves children's achievements in school. We worked to help enact the Illinois EITC in 2000. Throughout the years, we have continued to partner with fellow advocates to strengthen the credit. 2013 resulted in the biggest increase, more than doubling the credit since its inception to 10% of the federal EITC for families with children. Under the new law, a single mother with one child earning minimum wage or $12,800 a year will save $154 on her state income taxes for 2012. To quote Erica Williams of the Center on Budget and Policy Reforms, who is here with us today, the EITC is the most effective anti-poverty tool we have. Over the past several years, the Great Recession and the state fiscal crisis have stalled progress, eroded gains, or undermined achievements in many of these areas. State funding for early childhood education has been cut by more than 20% over the past 4 years. This year, 20,000 fewer children will participate in state-funded pre-K programs. The income eligibility limit for Child Care Assistance Program has been lowered from 200% to 185% of poverty level. Required co-payments have more than doubled in the past couple of years. What does this mean for a single-parent family with 2 children earning about $30,000? An increase of $1,140 out of pocket each year. The state fiscal crisis has been eroding important gains in reforming the child welfare system. Reported cases of child abuse and neglect have been fairly stable in recent years, but the number of DCFS child protection workers declined steadily between 2007 and 2012. Last year, the agency was out of compliance with frontline state requirements of a federal consent decree in all regions in the state. Further cuts to the DCFS budget would pose serious risk for the state's most vulnerable children. And lastly, mental health. Deep cuts in community mental health programs have set back efforts to promote the social, emotional well-being of children and adolescents. Since fiscal year 2009, the Department of Human Services funding for mental health services for children has declined by more than 20%. The findings in this report underline several management challenges and opportunities that we must address to ensure a better future for children and families in Illinois. One is the continuing state fiscal crisis. Pension obligations are consuming an ever-growing share of the state budget. The state has a huge backlog of unpaid bills. Essential programs in education, healthcare, and human services remain vulnerable to further budget cuts. Current income tax rates are scheduled to be rolled back at the end of 2014, which would cause state revenues to plunge and further undermine investments in children and families. We need a comprehensive and balanced approach to the state budget crisis, which must include adequate and sustainable revenue, strategic spending restraints, and responsible pension reform. We are seeing disturbing trends in child poverty. In 2001, about 660,000 Illinois children lived in poverty, up from 500,000 in 2000. Even more distressing is the fact that 1 out of 4 children under the age of 5 now lives in poverty. Even as the economy recovers, nationwide child poverty rates are likely to continue rising. We know that growing up in poverty, especially in early childhood, can harm children's health, their cognitive and social emotional development, and their economic opportunities as adults. There is a continuation of racial ethnic disparities in child well-being. The Illinois Kids Count report shows persistent disparities on a wide range of indicators, including child poverty rates, family income, health outcomes, and educational attainment. One example you see here shows that group disparities can begin at birth. Low birth weight babies are much more prevalent among African American mothers than among white or Latina mothers. We must make concerted efforts to ensure that children from all families and backgrounds have opportunities to develop their capacities and reach their full potential, as well as to become productive and responsible members of the broader community. In a given year, millions of children and adolescents across the nation experience violence, directly or indirectly, in their homes, schools, and communities. A growing body of research shows the traumatic impact of exposure to violence, especially repeated exposure, on the physical, emotional, and cognitive development of children. Illinois must develop a comprehensive set of approaches to the prevention, reduction, and evidence-based treatment of children's exposure to violence. Illinois Kids Count is based on the premise that public policy should be guided by accurate information. Data-based advocacy means using sound data combined with effective communications can contribute to better outcomes for children and families. Data can be a powerful tool for identifying problems, monitoring existing programs, and bolstering the case for our policy priorities. We need your help in a renewed commitment to building better lives for children. Be an active voice for Illinois children. Help us to spread the message of the importance of public investments in children and families. When we invest in all of our children, not just the ones at home or on our block, we all benefit from a vibrant economy, a stronger social fabric, and a brighter future. We all share the responsibility of making kids a real priority and not just a talking point. Let's get back to the basics by restoring and expanding investments in children, families, and communities. In conclusion, I would like to sincerely thank the members of the Kids Count team. It is through their devotion, perseverance over many, endless obstacles, and patience to create this annual report that is regarded by many as the most thorough examination of children's lives in this state. Many thanks to this team. Thank you.